So all of those things collected, I'm thinking about the meetings that you all may be having and understanding that portfolio and recognizing where there's maybe a star rating missed or an opportunity to do better. It's really important as you're developing a communication strategy to start with your what and your why. And those examples of what are the strategic objectives that we're trying to help our membership complete or take action on. This is just sort of an example collection of an output of what those internal discussions might look like for you. So one thing we know, and I know Sarah hears this dozens of times a week, is we have got to make sure that first and foremost, we're establishing a solid digital relationship with the digital tools that we've made. And then we can go on down the line from, we need to make sure that people have access to care. If there are care gaps opened, we need to make sure that there are tools applied that we can close those, condition management programs, and med adherence. This is just sort of an example of what it might look like as the output of one of those discussions when you take stock of where we're trying to move the membership.
Yeah, and I'll just add that we want to be asking these questions of you because ultimately these objectives inform the calls to action that we want to include on a print communication. So whether that's a member ID card or an EOB or a text campaign or an email going out to remind you about that other message you got, it's all very important to have it be a very clear call to action. And with this, right, there's an opportunity for one message to go to all, but through the learning that we'll talk about here momentarily, it's important to understand that you can start to segment your population, therefore specific calls to action that will really help drive certain populations to do the things that they need to do.
Yeah, I think the next step for each health plan to look at, regardless of what the collection of actions is for you, to the degree that you can understand your baseline utilization, that's going to be one of the most helpful numbers to know. If you're, let's say you have condition management programs and you know that you've got 50,000 diabetics out there and there's a program available to them that only 10 members are signed up for, okay, that helps us to weight where we put our energy. And similarly across these. So the data, and this is where we found that these communication strategy conversations can be so rich, is they allow you to reach across to different departments and say, hey, we're trying to support the data that you're pulling in terms of baseline registration. Where are we at in terms of our med adherence? If we've got a new mail order pharmacy program, how many people are enrolled in that? Because we want to start to try those, bump those numbers up too. So that's a great layer on top of this, is just where are we starting from. Mm-hmm. And then you can channel check yourself. So if, let's sort of play pretend and play in the sandbox and say, let's imagine a world where those are our really critical measures and those really critical actions that we want our membership to be more engaged in. What would it look like if a year from now we had 10,000 people who had taken when you see CTA here, call to action, if we had 10,000 more members in our digital adoption and just sort of engaged in paperless communications, for example, if we got people on our telemedicine app or program, if we had 10,000 more in-home assessments for some of those members, we really don't know because they have a gap in terms of their access. You can look across these, and then we've taken sort of a generalized or a conservative estimate of the value that a member participating in this action would generate. This is totally plug and play. If you feel that these numbers are too low, too high, based on the conditions you're talking about, adjust them. But when we talk about where Sarah and I are going to go with this, even if you took a much more conservative estimate, the ROI on driving these types of numbers through a nice and elegantly executed communication strategy are totally outsized. You're talking millions of dollars relative to a spend that for what Clarity supports with health plans is a requisite cost line item anyway. All of these things are going to be distributed to members. We're just talking about making them more sophisticated as you all can, to the tune of driving this value up. And of course, if you're doing this in other modalities outside of your print correspondence, all the better. But it's again helpful to say, we're asking members to do these because it's in their interest and it's in our own financial interest as well.